So this presentation is for new staff orientation for new team members joining Therapeutic Connections in our psychiatric rehabilitation program. I'm going to pause here for a second as I move my face down to the bottom of the screen so everybody can take a good look at my company logo as well as our tagline. So when you're putting your business together, you want to make sure that you get the most appropriate logo that's going to define you. Many of you heard of Nike and Adidas and so many others, Lacoste, all of these different organizations. 9 times out of 10, you've never heard of the CEO. You don't even know the name of the CEO, and that's all because of branding. So your logo is a brand, and it's really going to give a good description of who you are, what types of service that you provide. And here's our tagline, and that's where compassion and community come together. So as you can see, the tagline kind of coincides with that of the logo. So this presentation that I'm about to do is for all of the coordinators that come on board to join our team of coordinators at our psychiatric rehabilitation program, which is a wraparound program. So the first step that happens when we get a new client for our services is we're going to conduct a comprehensive assessment with the client and or the parent and the child. And we're going to find out all of the things that happen with this individual, all of the different domains in terms of how is their behavior at home, in the school, in their community involvement. Based off that information that we collect, we're going to gather as much information as possible about the challenging behaviors, and then we're going to integrate that and put it all into an individual rehabilitation plan. And IRP, or individual rehabilitation plan, is very similar to a treatment plan. And it's done every 6 months. And then we're going to talk about parent education and educate the parents on the diagnoses of that individual. Or just if it's an adult, we're telling that individual about their diagnoses and trying to gauge how much does that individual already know. And then one of the things we're going to do with everyone is we're going to discuss a proposed schedule of services. So these are 13 things. It's there in a checkbox form on our electronic medical records that these individuals can select from. So you give that individual, if it's an adult and or the parent, that ability to say, hey, these are the challenges, to identify where the challenges are within the behaviors that they have or the child has, and they check that off. And based off that, the coordinators meet with the individuals in the home and in the community, and together work towards coming up with favorable behaviors. And during the documentation, all of the documentation and the interventions have to be measurable and attainable as well. Here is our adult eligibility criteria for admissions. So all referred clients must meet the diagnostic criteria and have a priority population, which I'm going to show you in the next slide or two. They need to show that they have a need for assistance with basic living skills, have a severe inability to establish and maintain personal supports, and an inability to cognitive disorganization to procure financial assistance, to support living in the community, social behavior that results in interventions by the mental health system. These are the priority population diagnoses. So it's a little small, so I'll leave it on the screen for you to kind of zoom in a little bit. I won't go through all of them, but I'll skirt through 2 or 3. As you can see at the very top, schizophrenia is one, schizoaffective disorder, major depressive disorder, bipolar 1 and 2, but the most severe diagnoses that you could imagine an adult having would allow that individual to meet the criteria to be within our program, to get acceptance to our program. For our youth eligibility and admissions, they must prove that they have an impairment that results in either a clear or current threat to the individual's stability to live in his or her customary setting, and emerging and pending risks to safety of the youth or other individuals, or show some evidence of significant psychological or social impairment, such as inappropriate social behaviors causing serious problems with peers and the establishing relationships and or having some challenging relationships with family members. Some common youth diagnoses that we see or attention deficit hyperactive disorder, oppositional defiant disorder, post-traumatic stress disorder, adjustment disorder, anxiety disorder, and depression symptoms. And I'm going to change gears and then talk a little bit about the treatment aspect. So each individual that comes in our program, whether it's a youth or an adult, they're each assigned with a rehabilitation coordinator. So this dedicated rehabilitation coordinator would assist the clients in providing them with support in the home and or community. They have specific services that they would conduct with the client on during monthly visits. All services will be a part of the treatment plan through that individual treatment plan and our individual rehabilitation plan. And the referring therapist will be regularly updated on the client's progress in the plan of care. Also, these individuals are the rehabilitation coordinators are all supervised by a rehabilitation specialist. That individual is a licensed social worker. They can be a lower level licensed social worker, and they are able to identify and address the client's rehabilitation needs, coordinate and create and implement those individual rehabilitation plans. They supervise the coordinators on what types of behaviors to ask to implement or to seek out with the client to see what types of behaviors they're presenting, how to address those behaviors. And they provide crisis intervention. At Therapeutic Connections, we use a medical model. So if you think about historically like a patient that may have gotten the diagnosis of cancer, but when they leave that physician's office, they're told about what type of cancer they have, what kind of exercises they could do, what types of diet and nutrition they could do, what types of medication they're prescribed, any side effects associated with it. So, we want to take that medical model and use that and integrate that with our clients when we're meeting with them in the community. So identifying what is the disorder, what are the symptoms, what kinds of medications. So really following that same track with them as well. We use a SNAP approach to find out the strengths, the needs, the abilities, and the preferences of that individual, really trying to encourage them to know their own IQ and what that means as well. In addition, we do some on-site activities. These are just a list of different things that we discussed during the on-site activities, but just self-expression through journaling, writing songs, or it could be a sports activity or playing Uno board games. We can focus on anti-bullying, having a discussion on that, or finding the skills to manage behavioral health, and also identifying employment as well as health and wellness. Group topics for parents, they consist of and not limited to preventing parental burnout, parenting aggressive youth, compassion fatigue, balancing work and family, self-mutilation, if that's, and suicide, if that's one of the cases that they're dealing with, improving outcomes for youth in care, and helping youth set and reach goals. So for our org chart, you see the CEO or program director or program director. In this instance right there, I'm the CEO and program director for both. It could be the clinical director can also oversee the program for PRP, but nevertheless, the CEO program director in this instance is over the rehabilitation specialist. The rehabilitation specialist, like I shared, supervises the rehabilitation coordinator. We used to have a quality assurance specialist, but now we changed to have an administrative manager in that box right there that kind of assists the rehabilitation specialist with any administrative needs that are required for the organization. These are just some of the partners that we have. So as you grow your psychiatric rehabilitation program, you really want to have strong partnerships, some allies within the community to help you to achieve your goals, and also to send over referrals, and also folks that you can send your clients to get the assistance that they need in order to be successful. Parent education is huge. And when you're working with individuals with behavioral health, you can't just work with a 10-year-old and say, these are your issues, and develop these interventions and help that individual and leave and go on with your day. In order for any of the interventions to work, the parents have to be involved in all of the treatment that's being provided to the youth. We created these booklets that are specific to behavioral health, utilizing the medical model from a behavioral health lens, and educating parents and families on what is the diagnoses and what are the symptoms and the best therapies and the best evidence-based practices that we utilize. This is the one for our ADHD, attention hyperactive disorder. We discuss what are some of the behavioral things that this individual may experience, what are some cognitive challenges that they may have, what is their mood. Also common is depression or learning disabilities, but with behavior, they can be aggressive sometimes, can be very exciting, they can be fidgety. Cognitively, they can be absent-minded, have some challenges with paying attention. Their mood could be angry, anxiety, boredom. Also, these are some of the common therapies that are associated with a child who has ADHD. Support groups are really helpful. Cognitive behavioral therapy, anger management, interventions, psychoeducation, family therapy, applied behavior analysis. These are just some general basic classroom accommodations for a child who has ADHD, using flexible seating like wiggle chairs and standing desks, footrest, seat cushions or resistance bands for legs, increasing the space between desk or work tables, designate a quiet workspace in the classroom, and set up a preferential seating close to the teacher and or away from high traffic areas. With our program, we've been fortunate to go into a relationship and receive a contract through our local management board, whereas we provide psychiatric rehabilitation services for those individuals who have commercial insurance. So if you think about it, a psychiatric rehabilitation program is a Medicaid product. So meaning it's only available to individuals who have Medicaid as their primary health insurance. It's not available to any individual that has commercial insurance like Aetna, Care First, Blue Cross Blue Shield, United Healthcare. But through this grant opportunity, we're able to service a set amount of individuals with the services that we provide, and then we get reimbursed through county dollars to support individuals who have commercial insurance. And it helps these individuals to have lower emergency room visits or psychiatric hospitalizations. They're able to achieve goals such as getting employment. It's just been amazing, and we're on our 5th year with it. So that's been going pretty well with us. We provide the psychiatric rehabilitation for some adults, because it goes from the ranges from 3 to 24. So in our world, an adult is 18 years old to 24 years old, and that are eligible is like 24 is cut off for commercial insurance. Through Medicaid, it's up to 65 plus based on their eligibility as well. But that's generally what our grant is for, through a Building Youth Resiliency grant. And that's pretty much our program. I do want to say one of the things, the cornerstones of our psychiatric rehabilitation program is that we just reinforce what the therapist is working on with them in therapy treatment. I always, when I'm doing presentations and I'm talking about a psychiatric rehabilitation program, I always liken it to the Super Bowl. And when, at the Super Bowl at the beginning of the year, you have the 2 last teams, the best teams in the National Football League, that are going for the championship. Well, those two teams, they just don't get there by showing up. They get there by practicing and running plays and learning plays and executing and training and working hard and weightlifting and eating right, making the right decisions. That's what our psychiatric rehabilitation program is for, is to reinforce what's working in therapy. It's to collaborate with that therapist so that that client can reach those optimal goals. So every day of their life is like a Super Bowl. They're in the game and they're working towards making the rest of their life the best of their life, and really working hard to reach their goals. So I hope that this presentation was helpful to you all and that you know a little bit more about the psychiatric rehabilitation program and our services. Thank you.